Good morning. I'm Dr. Suhail Madi from Advanced Dentistry Center in Bingham Farms, Michigan. I want to talk to you about why we need to do bone graft. Bone graft is needed in order to build the jawbone so we can put a dental implant. Now, doesn't everybody need it? How important to have it? Is it something extra that sometimes dentists do it to help? But here's how important it is. Every time a tooth lost, tooth sits inside the socket, and so basically it's an empty space. After removing the roots of the tooth, it leaves an empty space, and usually when that socket heals, and especially if you have a thin bone surrounding it, it's going to shrink, so you're going to lose a big percentage of that bone, height and width. So we'd like to preserve this bone. So the best time is done is when at the time of the extraction. Then when we pull that tooth out, is to place some kind of materials look like sands. Usually it's we call it allograft. It's born from basically cadaver that's been treated and tested a million times, to make sure it's safe to be used for human. And we place it there. We mix it with sometimes saline or bone graft or antibiotic or different materials, and then we add it. We put it in that socket to help preserve the socket and keep it from shrinking. Now, if we leave that bone, and we don't put implant in that site for a long time, of course that bone, the body will resorb that bone with time. And so it's important that after removing the tooth and putting bone graft, it's the ideal time, I would say 6 months, 3 to 6 months, maximum a year, if you want to maximize that ridge width and height, and you don't want to lose a lot of bone. And that's number one. Number two, sometimes patient comes to us and they want implant, and the tooth has been lost like a long time ago, 20 years ago. Then we have to look at it. There's a big amount of bone that's been disappeared from not using that site, and so we have to evaluate it. Now, to do the bone graft at that point is going to be much harder, because there's no walls to put that bone like before we had the socket. So we have to put it and put some membrane, and all screws and all that, and all these things, adding a lot of cost, because everything's it's very costly when it comes to bone graft and membrane. And of course this cost is going to pass on to the patient, and obviously it could have been prevented if we're done before that bone, when the bone was there. Now there's some other techniques that also helps, where we can expand that bone using sometimes special techniques, special drills and special equipment to help us expand that thin bone by splitting it and expanding it. And that might either or might require basically additional surgery. So we will expand the bone, let it heal, and then go back to put the implant. Or if it's possible, we could put the implant at the same time. And of course, it's always better to wait to make sure that the bone heals, and before we put the implant, or even putting the implant at the same time, if that allows at the time of the surgery. Usually each dentist has different opinion about it, but pretty much these are the two techniques. Now we can get away with it without doing either or by using thinner implants. The implant comes in different diameter, and the standard one is 4 millimeter, and it depends on the tooth too. So if we're doing it, let's say for molar, we need to put like 5 millimeter implants, diameter, because just to compensate for that big molar tooth, versus basically doing a premolar or front tooth, that tooth are narrower. smaller, we can get away with a thinner implant. So you have to think about which tooth can we get away with putting thin implant and avoiding bone graft on that. So these are pretty much the different things, So and by doing a thinner implant and a molar, you're saving money, and you don't have to do the bone graft, and you're saving time. But you have to think about it long term too, because that implant is going to be under pressure for a long time, and under chewing pressure, it goes up to sometimes 250 pounds per square inch. And so these forces is going to be very strong with long term use. So you might have a problem with that implant. You might again, but it's if the more ideal situation we have, the better. And thank you. I'm Dr. Suhail Mahdi from Advanced Dentistry Center, and you can visit me on my website, advanceddentistrycenter.com. Thank you very much.